It is clear to you, all of you. So a very good morning to all of you. I am Dr. Priyanka Sachdev here, and I welcome you all for today's session. So today I am giving to discuss about the orientation, how to approach pathology in your second prop of MBBS, right? So as all of you are MBBS students, I guess. So when you start your journey of MBBS and you first pass your first prop, and you when you enter the second prop, you find pathology as one of the most difficult subject out of the 19 subjects of MBBS, right or not? So here I am to simplify your doubts, to clear your doubts about all about how to approach pathology as a second year MBBS student. Okay, so let me start. Before starting, let me tell you that on Unacademy we have two types of paid subscription. One is plus subscription and one is iconic subscription. So what is the difference between plus and iconic? In plus subscription, you will get access to live and recorded lectures of Unacademy from India's top educators. Not only this, you can compete with other learners in live tests and quizzes and compare your rank within them. Where you are standing, you will come to know. Not only this, you will also get an exceptional question bank which is specially curated by India's top educators for you people. It contains more than 25,000 new pattern clinically integrated image based questions. So I can guarantee you, if you practice all these question bank, all these questions from the question bank, along with watching live and recorded lectures of the top educators, your selection is guaranteed and your result you will pass with flying colors. That is the thing. And you will also download the notes. You will also get printed notes. So these are the benefits of plus subscription. Coming on iconic subscription, as we all know that Unacademy has recently acquired Prep Ladder, and Unacademy is India's largest online teaching platform. So here in iconic subscription, you will get a combination along with Unacademy of live and recorded lectures. You will also get benefit of Prep Ladder recorded lectures. So here on Unacademy, we focus on live batches, live classes. Here in iconic subscription, you will get an advantage that just before the exam, you can do a quick revision by watching the recorded video lectures from the dream team. You will also get rapid revision and snapshot, question bank and treasures. So these are the two type of subscriptions. You can check the details on Unacademy Learners app. You can select your plan, whether you want plus plan or whether you want iconic plan. You can select the duration of your plan according to your need, according to your wish. You can select the duration of your plan. You can check the prices of various plans. You can notice one thing here: longer the plan, cheaper it is. So I advise you, if you are a second prop, first prop or second prop student, go with a longer plan. It is much cheaper for you and it is highly beneficial and recommended for you people. And there is an exciting news for you. The exciting news is that if you apply my code, that is Sachdev10, to any of this plan before payment, you will get straightforward 10% discount on the existing prices. So don't miss this opportunity. Please remember the code. It is Sachdev10. It is SACHDEV, Sachdev10. So let me start my lecture today. So today I will discuss approach to pathology as a second year MBBS student. So many students ask me always that, ma'am, how to study pathology in the second prop? So they always have a big confusion how to start pathology. So we know pathology is one of the vital subjects in the MBBS curriculum. Out of the 19 subjects, pathology is one of the most vital subject. It is a fact. You know, don't believe me, ask your seniors. They will also tell you, because your seniors have studied all 19 subjects. Now, currently, if you are in second prof, till now you have studied only 3 subjects, that is anatomy, biochemistry and physiology, and you have just entered second prof, I guess. So if you have entered second prof, you have not seen what is medicine, what is surgery, what is ENT, ophthalmology, PSM, other subjects. But your seniors, the one who is intern or the one who is in final year, you can ask them. Pathology is one of the most vital subject of MBBS. You cannot skip pathology. If you skip pathology in second prof, you cannot understand. You cannot understand medicine and surgery in your final prof. So you can see, without understanding the pathophysiology of any disease, how you can understand the symptoms and treatment part? No, you can't. So you can say that pathology is the foundation of medicine as well as surgery. So you have to understand pathology. Now, the biggest confusion most of the students always have, they always ask me, ma'am, which book to refer for pathology? Name the book which we should read in our second prof, starting from second prof, which is the referring book which we should follow blindly for pathology. So we all know the answer is only one, the only one answer, that is the Bible of pathology. So we all know the answer. What is the Bible of pathology? Yes, of course, it is Robbins and Cochrane. So we have to study Robbins and Cochrane for pathology. It is the Bible for pathology, and there is no escape for skipping Robbins. So many students ask me, ma'am, instead of Robbins, can we read some other book? So there is some escape from the Robbins. We can skip it simply. No, the answer is no. You cannot skip Robbins. You have to deal with it. You have to read it once in your life. You have to. If you want to pass MBBS, of course, you have to read it. You have to read it. Now, what problems students face with Robbins generally? Though most of the students tell me, ma'am, it is incomprehensible. It contains big paragraphs. It is not bullet and concise book. It is the information is not in the form of the bullets, points. It is a big paragraph. So once we start reading the paragraph, we just lose the flow, and we don't get the overview what we are reading. So in the first reading, everything is bouncer. We didn't get anything, and the language is very difficult. So these are the common problems students face while reading Robbins. Okay. So how to deal with it? So here I am. I will help you in giving you an approach towards the Robbins. How you should deal with Robbins. How you should approach pathology from Robbins. Okay. So you must know this fact that the data given in Robbins, it is a combination of multiple things. The data given in Robbins contains physiology, which you have already read in your first prof, physiology. It contains altered pathophysiology. Altered pathophysiology. It contains altered pathophysiology. That is the most important portion of Robbins. Okay. Altered pathophysiology. It also contains targeted genes of every disease. If you can't understand this targeted genes of the diseases, you cannot understand the newer therapy in pharmacology. So you have to, and it is an integration of multiple other subjects also. Other subjects, you will get symptoms also. Each disease's symptoms are discussed here. So you will get a portion of medicine, that is the symptoms, a portion of surgery also, a portion of microbiology, especially in infections, immunity. So that is microbiology is also covered, and other subjects like ENT, ophthalmology. In the endocrinology, you have thyroid disorders, you have Graves' disease. So the ophthalmology portion is also covered there. ENT is also, and especially dermatology, that is also covered here. So it contains a combination of knowledge, a combination of information in this book you will get. Okay, so the most important question to answer today is how to complete this book, how to start this book, how to complete this book. So today I will discuss a very simple approach. I will help you, assist you in discussing this simple approach, how to complete this book. So students always have confusion, madam, should I start reading Robbins directly, or should I first read some other book and then jump on the Robbins, or should I directly jump on the Robbins, or should I read the notes from some other app, from Unacademy or some XYZ app, and then come on the Robbins? So what should be the proper sequence? Now in MBBS, you don't have much time to do the experiments. It is not the thing first you read Robbins, if it doesn't work, then first read the notes, then again come on the Robbins. No. Once the time is lost, it will never come back. So you have to be extra precautious here, right? Okay. So this is a simple strategy. It is followed by me. It is a full proven strategy, right? So just listen it, understand it, follow this strategy for at least few days, for at least next 1 week. Just follow the strategy and get back to me and give me your response how you get it. Okay, let me discuss the strategy. So whatever chapter you are intended to read from the Robbins, just suppose you are starting with the first chapter, that is cell adaptation and cell injury. So I recommend you to first watch the videos from whatever app. So if you all are in second prof, now I hope you all must have taken some of the online app. You have registered. So watch the videos. Here we are on this channel, on this YouTube channel, we will upload the videos of entire MBBS syllabus. So I recommend you to watch the videos of that particular chapter first, so that you will have an overview that what we are going to read in Robbins. Don't directly jump on the Robbins. The language is difficult. You will get only bouncer. You will not understand in the first reading what actually is going on. So first always watch the video from the educator you follow for that subject. And here on this channel, we will upload the videos of entire syllabus. Don't worry. Make your own notes from that video, from that app which you are following. Make your notes in your own notebook. Make a notebook, a big register for pathology, and start making notes. In your notes, don't write paragraphs. Don't write paragraphs. In my class, you will not find even a single paragraph. Write your notes in the form of bullets, in the form of the small points, concise points one by one, in the form of the flow charts. Try to make maximum flow charts. Pathophysiology of any disease, make a flow chart of it. Any disease you want to understand, make a flow chart. Make a flow chart. So understanding the diseases with the help of flow chart is really very easy, and it will be a fun for you people, right? Try to draw as many as images as possible. Now it is a scientific fact, our human brain, when we see on any theory thing, it will recall it in a minimum way, but when we see any images, you will not forget it. You will remember it for a longer duration. So it is a scientific fact. So any information given in the book, if you can draw an image for it, if it is an imaginary image also, it is not given in the book. If it is given in the book, that's it, you have to copy that. But if it is not given in the book, you have to read the pathophysiology and try to make the image. So in my class, I will give you this approach, how to make flowcharts and images by reading paragraphs from the Robbins. So you have to convert entire Robbins into flowcharts and images and bullets and points. So that is the thing. So first make your own notes based on your videos, your app, that is simplified. After that, always have a look on previous year questions in your university exam. Now you all are in second prof. If you are 2019 batch onwards, of course, if you are in second prof, you are in 2019 batch. Some of the 2018 batch ke students ke exam is not still over because of the COVID. It got delayed. Various universities have various schedule to be followed for the university exams. Anyways, if you are 2019 onward student, you know you have only 1 year. You have only 1 year, that is 12 months for the second prof. Initially, we used to have 18 months, but now in the revised curriculum by NBE, we know we have only 12 months for second prof. And forensic is not included in the second prof, it is included in the third prof. So we have only 3 subjects now, that is pathology, pharmacology, and microbiology, that has to be covered in 12 months. So there is always a list of any topic you are starting. Just suppose you are starting the first chapter today, cell adaptation and cell injury. So there is a list of at least 25 to 30 questions that is passed from generations to generation. Your senior will give to your super senior, will give you to your senior will give that list to you. So it is passed from generation to generation, that contains a list of 25 to 30 questions from every topic. So in total, at the end, if you cover entire pathology, you have at least 500 questions in your hand. These are the questions, these are known as most frequently asked questions in your university exam for the theory paper. So you must be knowing the most important points. Most important. No, it is the human psychology. If you are reading the chapter, if you know this topic is already asked last year, before last year, it is already frequently asked question which comes frequently in the theory, your brain will automatically read it better, adopt it better, understand it better. And if you know this topic is not even asked till date, it is not asked till date, so automatically your brain will take that it is not important, so why should I read it? Okay, I will read it, but it will not be gathered in your permanent memory. You will take it in your subconscious mind. You know, ye to come important hai, ye to come important hai, we can skip it. It is a human psychology, you cannot change it. It is for me also, for you also, everyone is same. You know, everyone is psychologically we are same, right? So that is the thing. So if you know what questions are important, so from each chapter you should know 25 to 30 topics which are important. So my suggestion, take your Robbins and mark that topics which are asked in your university exam. That should be your third step. After that, solve the question bank. Don't just skip, jump on the Robbins. Solve your question bank. Now, whatever question bank you are following, you may be following the question bank of Unacademy. We have the most updated question bank containing more than 25,000 clinically integrated questions for the next. You know, in next there is integrated. The integrated questions are going to come in your exam, right? So solve your question bank first. Solve your question bank. See, first guess from the 4 options. What is your guess? Based on the videos, you may be knowing the answer. Some of the questions will be like this. You have not read, you have not watched that, understood that in the video. So your guess may be wrong. Then see the correct answer. Read the explanation. Whatever important extra points you get, add in your notes. Add in your notes. Always add on in your notes. Always keep on doing the top ups on your note. First make a basic note और उस पे top up करते जाओ करते जाओ करते जाओ. That is the thing. Then now it's time to switch on the Robbins. You cannot directly jump on the Robbins. That's why students do this mistake, the biggest mistake. They just enter in the second year and they are hyper excited. No, we will start pathology with Robbins. They just start Robbins, reading first chapter, second chapter, Everything is bouncer and they just leave the book. No, it is not a book, good book, and it is not for me. They just do it. So it is not the thing. It is not the thing. Have you got it? So what are the steps? First, you have to watch the videos. By watching the videos, you will get a bird's eye view, overview of the chapter. So in cell adaptation, just for example, cell adaptation, cell injury, cell death, I have to read the 5 type of adaptations. I have to read the reversible, irreversible mechanism of injury. I have to read necrosis. I have to read apoptosis, calcification, aging. So these are the important points which we have to study from the this chapter. So you will get a overview for the better understanding of the concept. Now if you read the book, you will have an overview already because you have already watched the video. So first step is watch the video. Second step, make your own notes. Now I know notes are downloadable. You can download the notes from various apps. You will also get printed notes. You can take a printout of the notes, but own notes are the own notes. You have to write by your own. So again, a scientific fact. I'm going to tell you one scientific fact. If you read anything now, you will forget. But if you write anything, you will never forget. It is not said by me. It is a scientific fact. It is proven in multiple studies. So if you read anything, there is always a probability that you will forget it. But once if you write it now, you will never forget it. That is my guarantee. So always write in your own words, in your own language, in your own form, whatever you think, just note it down. Make a notebook today only for pathology. So that is the thing. Make your own notes. After that, see the PYQs, previous year question of the university exam, whatever university you are belonging to. You may be from South, Kerala, Tamil Nadu, Madhya Pradesh, Jabalpur University, Maharashtra University. So whatever is your university, for your university exam, the important questions are same. So if you wish, whenever I will teach you pathology for your MBBS, now I will share these PYQs chapter wise for all universities all over the India. I have this grand collection of previous year question. So in this previous year question, you have 1 mark question, that is short question. You have 2 marks question, and you have long question, that is 5 mark question. So you should have a collection of all these questions. So which questions are frequently asked for 1 mark? Only 1 line has to be written. Which questions are frequently asked for 2 marks? So you have to write a few points about it, make a flowchart, make a small diagram. And for 5 marks, you have to write pages, at least 4-5 pages for 1 question. So long questions are really very important. In your exam, you get 2 long questions and few short questions, right? One of the long question, if it is wrong, you always get scared whether I will pass the university exam, yes or no. So that is the thing. So always get a list of important topics from the university exam. I will share this list with you. Don't worry, chapter wise. Done. Then solve your question bank. And from the question bank, take out the topics which are important. No, it is not necessary the topics which are important for university exam questions. The same topics are important for this question bank. Now, after passing second prof, you will go in third prof. After third prof, you will go in final prof. Third prof part 2. After that, you will enter in your internship. After that, you have to give your competitive exam, whether it is next, whether it is USMLE, whether it is whatever competitive, whether it is FMG. So whatever exam you are targeting, you have to give that exam. In that exam, these MCQs will come. So simultaneously, by getting yourself prepared for the university exam, simultaneously you have to prepare for that also. In your NEET, USMLE, FMG, you will get MCQs from all 19 subjects. We all know that. So after the second prof, once you will enter in third prof and final prof, you will not have any time to look back at pathology. Once you will finish your pathology in second prof, directly you will deal with pathology in your internship. So that is the thing. So you have to be prepared for these exams also. For that, you have to solve your question bank simultaneously. And not only for these exams, in many universities, theory paper contains 10 to 15 MCQs. So you have to solve those MCQs also. So you have to see for important topics for theory paper and important topics for your question bank. It is not necessary the 2 topics are same. Just suppose you are starting with lung, the respiratory system in systemic pathology. So most commonly asked question in university exam is jaundice. It comes every year or every alternate year, jaundice or cirrhosis. So these are the important topics which comes frequently in university exam. But if you talk about question bank, lung tumor is very, very important topic on which question comes almost every year in your competitive exams. So it is not necessary that topics coincide, but you should know the list of the topics. Now come on the Robbins. Next step is to come on the Robbins. Robbins mein kya? Now in Robbins, we have 20% of the Robbins is literature, 30% of the Robbins is concept building stories, and 50% of the Robbins is actual content. Now you have already made your notes. Now here you have made your notes by watching the videos. So this portion is already over. You have already covered this portion. Actually 50% of the actual content is already given in your videos, in your app notes, in your other notes. So it is same everywhere. Whether you follow any app, it is same everywhere. So actual content is already done for you. So half of the work, 50% of the work is done. This 20% literature, you have to read it once, but it is not really very important. So previously what was happening, now what is happening. So this literature portion you can skip. Only thing now you have to read in Robbins is concept building stories. You have to build your concepts. You have to build your concepts. Have you got it? Have you got it? Okay. So in Robbins, what you have to do, just suppose what I used to do, you have to start the first page of any chapter like this. This is the first chapter of the first cell injury and cell death I am starting. So take your sticky notes. You all may be having this notes. So stick 2 sticky notes on the first page of every chapter, and you have already listed the important topics for your university exam and for your MCQs. So on one sticky note, write the important topics from this chapter in your university exam. In your university exam, what is frequently asked from this chapter? Enumerate that topics, not exactly same question, that topics. And in your MCQs, what topics are frequently repeated, on which MCQs come very frequently? You have to write that topics in the first page of every. Now start reading the chapter. Now you know which topic is more important and which topic is less important, which topic is more important for your theory, which topic is more important for your MCQ. Now automatically your brain will adopt with this concept, and whenever you read any topic which is important for theory, you will read it with more consciousness, more memory, right? So that is the thing, that is how. So Robbins is not one read book, you have to read it twice. So first do a first read, then second read, and always whatever extra points you get, you have to add on to your notes. Otherwise, there is no use of reading Robbins. There is no use of reading Robbins. You have always extra points jo mile, you have to add in your notes now. On the last day of your revision, you cannot open Robbins. You cannot open Robbins. It is not the thing, tomorrow is my exam and today I will revise the entire Robbins volume 1, volume 2. No, I can revise my own notes. But once you have read the Robbins, you got this point extra, which is not there in my notes. So just add these points in the form of the bullets in your notes. Give me a thumbs up if you got it. So once you read the Robbins, any chapter, then you have to add sticky notes, key points and bullets from that, whatever extra you are getting, to your already existing notes. So all, you are reading from multiple sources, from multiple apps, multiple educators, multiple things, multiple books, all have to be gathered at one point. That is your notes. Everything you add at your notes. So at the last day of your exam, you take only your notes. It contains everything. From multiple apps, the knowledge is already concise. The multiple books, knowledge is already concise inside your notes. So one channel you have to follow in the last day of your exam is your own notes. And believe me, you will never forget your own notes. Once you have written with your own hand now, you will never forget it. Please believe me. You just follow it and just get me back whether this now works for you or not. I'm damn sure. Just believe me, it will work. It will work. There is no plan B. This plan will definitely work. Definitely work. Now, another most important question or doubt students have, ma'am, how many number of pages should I read from the Robbins daily if I am a second prof student? If I am a second prof student, my friend used to study 50 pages daily. My another friend used to study 30 pages daily, but I can read only 10 pages. After 10 pages, everything is bouncer and my mind cannot absorb it. Now, Robbins is a very compact book. When you read one page, now it is very volatile also. Once you read it, you will understand. But once you move to the next page, the last page is gone. So it doesn't happen to you. It shouldn't happen to you. Have you got it? So number of pages is really a variable thing. It depends from person to person. Some persons read fast, some person read slowly. But the only thing which you should take in consideration, whatever you are reading, you should understand it. You should understand whatever you are reading. Reading is not important. Understanding behind reading is important. If you are reading one page from this to this, from this corner I started reading till this corner. So it is a compact book. I am reading everything. It is not the thing in how much minutes, in how much seconds I have read this page. No, you have to understand this page. Now, understanding is important. That's why I am telling you, first watch the videos, then come on the book. Directly, if you read it now, you will require 15 to 20 minutes for each page to understand it in depth. You will read each and every line and you will think why it is happening, why it is happening, why it is happening. So the concepts first you have to understand in the videos. Once you have seen the videos, and then you will come on the book, you will understand each page in 5 minutes or 7 minutes. So it's your speed. You may be reading 10 page but with accuracy, someone may be reading 50 pages without accuracy, so without memory. So there is no use of reading more pages. It is not the competition between the friends that I am reading 100 pages a day, 50 pages a day, you are reading only 10 pages. No, reading 10 is worth if you understand everything. That is the thing. And you should make a schedule that what I have to read from the Robbins, how much time I am having, till what month I have to complete. So it is November now, not till what month you have, depending what batch you follow. If you follow 2018, your exams are near to come. If you are 2019, your exams are next year. So depending how much time you have to, accommodate your speed accordingly. But whatever you are reading, please convert it into sticky notes, key points and bullets. Don't keep it in the form of the paragraph. Just suppose I read this page completely, I have marked the important points with the help of highlighter here, and I close the book. Now what will happen during the last day of your exam, when you go for your university exam or your next FMG, whatever exam you are going, you have to revise the pathology. You cannot take Robbins volume 1, Robbins volume 2 and open each page and revise it. No, you have to add these sticky points, bullets into your notes, That is the thing. Have you got it? Do you have any doubt? If you have any doubt, don't hesitate to ask. Don't hesitate. Okay, 2021 MBBS batch. Tanvir is saying, will we get first lecture on this channel? Yes. So Tanvir, on this channel, that is Future Doctors, you will get entire MBBS syllabus, starting from anatomy, biochemistry, physiology of the first prof till medicine, surgery, OBGPedia of the final prof. So all 19 subjects we are planning to launch here on this YouTube channel. And the main purpose here is not to, make you masters in solving MCQ, but to make you masters for giving your university exams. Now, university exams are different from cracking your competitive exams, right? In university exams, you get subjective things. In competitive exams, you get objective things. Now, most of the apps are giving a knowledge for solving MCQs. But I have seen students, ma'am, MCQs to baad mein, we will see it in our internship. But what about the second prof? Wo kaise pass hoga? So that is the problem most of the students are facing. So that's why we came up with this idea to help the students to crack their university professional exams. That is too important now. If you get distinction in pathology or any subject in your MBBS, so you should have in-depth knowledge of that. Not only for cracking your competitive exam, but for clinical practice also. Once you will be in the field, you are doctors, you are second name to God, So people don't believe in machines. Patients don't believe in machines. Patients have trust in you. If you are saying a patient that do this investigation, this is the treatment for you, this is the right surgery for you, patients believe you. So you are like second God. Whatever you are telling them, they are believing you. So you should be expert. You should be master in your subject. So that is the thing. That is my point. So for that, thorough knowledge of all 19 subjects is required at MBBS level. After that, of course, you will do your masters in one of the branch. Either you will be a dermatologist, you will be an ophthalmologist, you will be an orthopedician, pediatrician, gynecologist. So there are multiple branches depending on your choice, on your rank, on your other things. You will decide in which branch out of the 19 branch you are going to do your masters. That is a separate issue. But being MBBS, at the MBBS level, what you should know, that university exams help you for preparing that. So for that, you have to take these university exams very seriously. Have you got it? Do you have any other doubt? Please ask. Now, as I was telling you about Robbins. So this was our strategy. Now, in our strategy, where is our strategy? Just a second. So this is our strategy. So we have started Robbins. So Robbins first read. So some students do only one read of the Robbins, and if they watch the videos properly, make their notes already before coming to the Robbins, so they got Robbins in first read only. But most of the students, even I, including me, I didn't got Robbins in the first read. So when I was in second prof, when I was in your shoes, I read Robbins twice in my second prof. But at that time, second prof was 18 months. So I did it well in the 18 months, and now we know it is only of 13 or 12 months, the second prof. But forensic is reduced now. So one and the same thing, so almost same proportion you are having, same proportion of time you are having for the three subjects, patho, pharma and micro. So Robbins second read may, if you are going to do the two reads now, in the first read, don't add on notes. In the second read, you will have a better understanding, then add on the notes to your existing notes. So read Robbins, add on your notes, from the extra points which you are getting in the Robbins, which you are not included in your notes. You have to include that into that. So that is how. Now we have discussed how many pages you have to read daily. That is number of pages. That is the biggest question. After that, the next question students ask me, ma'am, what about next day? Today I read 20 pages. Today, 3rd of November, I read 20 pages of Robbins. Not tomorrow, 4th of November, when I start. So should I start from the next page where I have left? Or should I first revise these 20 pages, then come on the next page? So that is the biggest question. If I say, if you first revise these 20 pages, then come on the next page, it will take time. And if I say directly come on the next page where you have left, start from that point only. So it is very volatile. Yesterday, what you have forgot, you are in the middle of the something you have left there, you will not have a better understanding ahead. So my advice to you, revise these 20 pages, not entirely from the Robbins, but from your notes. You have already added to your notes. Now, what extra point? So just suppose you have started a topic that is endocrinology. You are in the thyroid. You have to start thyroid malignancies. Yesterday, you have studied hypothyroidism. Today, you have to start hyperthyroidism from Robbins. So first, revise hypothyroidism from your notes. You have already added extra points in that. Then start hyperthyroidism. So that is my point. So first, always give. So yesterday, for reading these 20 pages, you require at least 4-5 hours. At least 4-5 hours you have required for reading this 20-30 pages. But today, just in 30 minutes, you will be able to revise it. So just dedicate the first 30 minutes for the revision. Just see, always set your watch. Always set your watch. So always wear a watch, set your watch before going to study. So I'm starting my study today. For the next 5 hours, 4 hours, I'm going to study Robbins. So for the first 30 minutes, first I will revise what I have studied yesterday from your notes, not from the Robbins entirely, from the bullet points which I have made. And then I will move to the next today's target. So my today's target is these 10 pages, these 20 pages, whatever you say. Done. So that is the thing. Now, in the end, the last step, we have finished Robbins. First read also, second read also. After that, what about just before the exams? Just before university exams, you will say, ma'am, Robbins is a big book. How we will write answers in your university exam from Robbins? It contains only paragraph, and we read it, we understood it, but we cannot frame the answers from it in our theory paper. Yes, that is the problem faced by me, many other students. For that, I recommend just before 1 month of your university exam, you can take any other review book. There are many small review books. One of them is a good book, Harshmohan, but that is for your just before 1 month of your university exam, not for the entire year. So you have 12 months now. Out of 12 months, stick to Robbins for 11 months. And last 1 month, dedicate to any other review book which will help you in writing your answers easily. So you already know the concepts now. Now reading Robbins will be a cakewalk for you. You can make it out. A point, A point, A point. So that is the thing. Have you got it? Have you got it? So this is the strategy that you have to follow. Not just follow the strategy and get back to me. So just follow the strategy for 1 week and get back to me whether it works or not. So start with your favorite topic. Open Robbins today. Think what is your favorite topic, whether it is from general, hemat, or whether it is from systemic. What is the best topic you find? What is the most interesting topic you find from the entire pathology? Start from that topic. Don't start from a boring topic. And please follow the sequence. First, watch the videos available to you. Make your own notes. Then see the important list or important topics of university exam previous year questions. Then see the important topics here from MCQ point of view. That it is not necessary the both things should coincide. The important topics for university exams are different and the important topics for MCQs are different. You have to see the both because you have to solve subjective exam also, objective exam also. So the topics may different. You have to list them, write them 1, 2, 3, 4, 5, enumerate them. Then start reading Robbins. Robbins, read 1, read 2. During read 2, my advice, my humble request to all of you, please add on to your existing notes. Whatever extra point you got it, please add in your notes. Don't try to make notes directly from the Robbins. Nobody till date have converted Robbins into the notes. If you're thinking like this, you are underestimating Robbins. Don't underestimate Robbins. No, you can't. Nobody till date, even I can't. First, make your rough notes, your gross notes. Then you can do the add-ons. Now in the Robbins, multiple genes are given for each disease. Don't go in the detail of each and every gene. Otherwise, you will get mad and you will not, at the end of the day, you will not get anything. So most important genes which are given in the bold letters, you have to take that only. from the path. So while I will, if you watch my videos now, you will get what is important from Robbins, what is not important from Robbins. And just 1 month before your university exam, take another book, a review book, a small book like Harshmohan, so that you will crack your exams in a better way. Have you got it? Have you got it? And always make a habit. Please discuss the topic with your seniors if you get an opportunity. So there may be some senior now who is your ideal. So always discuss that topics. No, your seniors have studied, especially if he's a final year, he or she is an intern. He or she has studied all 19 subjects, and till now you have studied only 3-4 subjects. So you don't have an overlook of the complete scenario. So once you will discuss the topic with your seniors, now they will tell you some important other things also. No, this is also important. So medicine में ये भी है, इससे related है, surgery में ये भी इससे related है. So you can correlate the things better. So always no, don't study isolated. Discuss the topics with your colleagues, with your seniors, especially the interns, the final year if you get an opportunity. Have you got it? And always apply the red knowledge into your clinical postings. Your clinical postings are already there now. From the second year you start your clinical postings. So don't miss those clinical postings. Go to the clinics. We are reading books. We are reading the complete pathophysiology of the diseases in the books. But when we actually come in the field, when we will get our certificates, you people will get your certificates, you are doctors now. You don't have to deal with books now. You have to deal with the patients. The live patient is in front of you. The patient will tell you the symptoms. Doctor साहब ये complain है, ये complain है, ये complain. I'm having headache, I'm having fever, I'm having sore throat, I'm having this, I'm having that. Now you give the diagnosis. What is the diagnosis? What is the treatment? What is the prognosis? The 3 questions, the questions the patient asks to you. So you should be answerable to these questions. What is your diagnosis? What is your treatment? What is the prognosis of the disease? For that, you have to diagnose the disease based on the symptoms. Patient will tell you only symptoms. Patient will not tell you and he will come, doctor, I am having a stomach cancer, I am having a colon cancer, I am having pneumoconiosis. No, they will not come with diagnosis. They will come with the symptom of that particular disease. So you have to correlate everything. Symptoms from the medicine, investigations from the pathology, make a form diagnosis, the combination of the two, treatment part from the pharmacology. So you have to compile all 19 subjects in a live patient. So that you can do in your clinical postings, right? So don't miss your clinical postings. Have you got it? Please follow this strategy and get back to me. And please don't forget to drop your experience in the comment box. Whether you got benefit from this strategy, yes or no. I'm damn sure you will. You will. Trust me, you will. But just follow it now. So, okay. Now coming on the syllabus of pathology. Broadly, we all know in pathology, we have 3 branches, 3 topics. So, general pathology, hematology, and systemic pathology. In hematology, there are only 3 chapters, or you can say 4 chapters in the Robbins 10th edition. Now, for Robbins, please follow the latest edition. Purana wala edition the senior has given to you. No, don't follow that. Please, latest edition ही लेना है. If you are not taking a hard copy, please take a soft copy, digital copy. Digital copy is easily available, so you can do that. Or you have to follow the latest edition. That is the 10th edition now, right? So in hematology, you have RBC, you have WBC, you have platelet. Initially, blood transfusion was not included, but in the latest edition, blood transfusion is also included here. So these are the 4 topics in hematology that cover to cover we have to do. There is no escape. In RBCs, we will study all anemias. We know anemias is the most common pathology which we find in normal population. WBCs, all leukemias. It is very commonly asked question in university exams also, in MCQs also. And platelet contains all platelet disorders. Blood transfusion is also very important. That is the thing. Coming on general pathology. Okay, let me talk about general. Now, the biggest mistake students do. Now, your volume 1 of Robbins contains general pathology and volume 2 of Robbins contains systemic pathology. Now, it is a myth in most of the students. Seniors, I don't know why. Our seniors also, they told us that please read general pathology with detail. Don't go in the detail of systemic pathology. It is same as that of medicine. It is same as that of surgery. So you will study medicine and surgery in your final prof. So don't go in detail of the systemic pathology. Go in detail of the general pathology. The first 10 chapters of general. So it is a myth. Your seniors may also have told you this, but no, please break this myth. No, it is general pathology. Systemic pathology is equally important as that of general pathology. You cannot skip it. You have to read both volumes of Robbins, volume 1 as well as volume 2. So it is already, I have seen in many students that they give more importance to volume 1 and they just underestimate volume 2. That volume 2 तो मैम systemic pathology है ना, वो तो फिर से पढ़ेंगे ही medicine में. So no, it is not the case. It is not the case. So for understanding medicine, it is the foundation of medicine. That is systemic pathology. You have to study here only. So that is the thing. In general pathology, you have to make your concepts that you have to apply in systemic pathology. Just suppose in general pathology, you are studying inflammation, acute inflammation and chronic inflammation. Now in systemic pathology, you will understand various diseases. So it is meningitis, itis, it is acute inflammation, bronchitis, appendicitis. So various itis you are studying. So you are applying the concepts of general pathology into systemic pathology. So in general pathology, concepts are more important than facts. You have to understand it. And in systemic pathology, the facts are more important than concepts. Concepts you have already built in general pathology. You have to apply those concepts in systemic pathology. So once I will teach you now, all these things will be clear to you. In general pathology, we have 10 chapters. These 5 and these 5. So I recommend you, highly recommend you, if you now many students will say, ma'am, for you saying is easy, read complete Robbins once, twice, but for being a student, it is at our level, it is very difficult. I can understand your problem. So if you can't read the complete Robbins, at least from general pathology, you have to read these 5 chapters. This is must. You know what is must? So you have to divide your syllabus into 3 things. Must know, good to know, and better to know. So that is the 3 things. Must know are those which you can't escape. You have to read those topics if you want to pass your exams at least with 50%. Good to know if you want to score better, 70%, 80%. And better to know if you want to excel, if you want to top. So that is better to know. So these are the must. These 5 chapters you have to study from Robbins. That is cell adaptation, cell injury, cell death, apoptosis, necrosis, inflammation, both acute and chronic, healing, neoplasia. There is no escape. You have to study neoplasia because oncology is the most, with the increased prevalence of oncology nowadays, this chapter is really very important. And many examiners like this topic very much and they always frequently ask question from neoplasia and hemodynamics. This hemodynamic portion is the basic you have already studied in physiology. If you have studied the physiology very nicely, you will not get any trouble in understanding hemodynamics. So these are the 5 chapters which you must do from general pathology. These are the 5 other chapters, that is immunology, infection, genetics, environmental and nutritional diseases, diseases of infancy and childhood. If you get time, read it from the Robbins. If you don't get time, it's okay. It's okay. Immunity and infection are well covered in microbiology. So you will get an overview there also. Genetics, you have to read only important diseases, Down's disease, Klinefelter syndrome, and diseases of infancy and childhood, you will read these well in pediatrics. So you can directly go for these 5 chapters from your review book, that is Harsh Mohan. But these 5 you have to read from Robbins. That is about general pathology. Let me come on systemic. In systemic, these are the 6 systems which are must read from Robbins. You cannot escape these 5 or 6 systems from Robbins. If you have skipped it once now, you are doing biggest mistake of your life, let me tell you. That is in volume 2, you have to read these 6 systems: blood vessels, cardiovascular system, respiratory system, renal system, GIT and hepatobiliary system. Believe me, you have to read these 6 systems from the Robbins. Rest of these 6 systems, that is endocrinology, male genital system, female genital system, CNS, musculoskeletal system and skin. These 6 systems, if you wish, you want to excel, you can read it from Robbins, of course. But if you are, Robbins is too much for you and you're not getting the time, then you can read it from some other review book also. It's okay. So that is the thing. So that is the thing. Now you have 2 options. In second prof, either you are covering only pathology, the second prof subjects, that is pathology, pharmacology and microbiology. That is the thing. In the 12 months, you are doing that only, or the other option, you are integrating the subjects. What do you mean by integration? So once you read any topic from patho, pharma, so just suppose CVS patho, you have read, CVS pharma, you have read, systemic की बात कर रही हूँ मैं, general की नहीं. So CVS from the medicine you should also read. You should. So what is medicine? It is the combination of patho and pharma. No? Only symptoms are added. Pathogenesis already you have studied in pathology. Treatment portion you have already studied in pharmacology. Now add this symptomatology, so it will be medicine. So for better understanding, you should do like this. So not only with CVS, with all systems, respiratory you are reading from here also you should finish it simultaneously. But the only thing, it will become too, hectic for you. But it's okay. If you can follow that hectic schedule, it is good for you. So at least from medicine, I advise you to cover these 6 systems of, along with patho and pharma. So what should be your sequence? So start CVS, read it first from patho, then read CVS from pharma, and then read CVS from medicine and surgery. So that is the sequence you should follow for all these systems, at least for these 6 systems. That is the integrated way of studies. Now, after next to next year, we have next as an exit exam. We don't have NEET PG, we don't have NICT, we don't have other exams. So next will be the exam that is going to be integrated exam, in which examiner will test you how much you can integrate all 19 subjects. So this should be your strategy, I guess. Now, coming on the university exams, last topic. In university exams, we have theory paper. We have two theory papers, theory paper 1 and theory paper 2. In theory paper 1, you get general pathology and hematology, that is 100-mark paper. In theory paper 2, you get only systemic pathology, again 100-mark paper, right? Practicals are again 100 marks. And you know the thing, you have to pass individually in paper 1, paper 2 and practicals. It is not the thing you have to get total 50%. You have to get at least 50% in each of them separately, right? And in many universities, there are 10 to 15 MCQs, which is a part of the theory paper 1 and theory paper 2. So these are the things you have to cover for your university exams. Now for theory, let me tell you something for the theory for university exams. For university exams, don't write paragraphs in your university exam. Write your answer in the form of the points. What are the headings? What are the points? Any disease asked in your exam. It will be a disease now. Any disease, whether it is endocarditis, it is appendicitis, any disease coming in your exam, write in points. First, write the introduction about that disease, then the etiology of that disease, risk factor of that disease, pathogenesis, the most important, how that disease developed in human body. Tell me the mechanism. In the form of the flow chart, try to make the pathogenesis of all disease. Then clinical features of symptoms, signs, radiology, that is other investigations also, gross, microscopy is most important portion in pathology. So for microscopy, I will teach you how to draw microscopic diagrams of various diseases, right? I will tease that for you. For most of the students, it is pink and purple color. No, it is not the thing. I will help you in understanding the salient features inside that. Have you got it? Then the prognosis and outcome. So all diseases you have to describe under these headings. If it is a habit for you from day one, if you are following this sequence for all diseases, any topic, it will be very easy for you to crack your theory exams with distinctions. That is my words. Mark my words. Take my words. That is my guarantee. Have you got it? Now that is about the theory for paper 1 also, for paper 2 also. So you have to follow the same sequence. Coming on practicals. What about practicals? In practicals you have spotters. You will get, in most of the university, you will get 10 spotters, 1 mark each. So in spotter, you will get a time for 1 minute. You will get a time for 1 minute. Within 1 minute, you have to identify the thing, and whatever question asked about that, you have to write in your exam. So that is a spotter. You have to identify on the spot. So I will help you with all the possible spotters possible in all universities throughout the India, throughout universities in India. So it can be an instrument, it can be a card, it can be a specimen, it can be a slide. So I will help you with all spotters, don't worry. And there are 5 exercises. Mostly there are 5 exercises in pathology. One is DLC, differential leukocyte count. One is hemoglobin estimation. You know hemoglobin estimation. One is blood grouping. You all may have this blood grouping, right? The 4th one is urine examination. And the 5th one is one slide. You will get one histo slide to describe it. So these are the 5 exercises. I will help you with all these 5 exercises. So all these 5 exercises have their table viva. So you will have 5 vivas, 1 viva on DLC, 1 viva on hemoglobin, 1 on this blood grouping, 1 on urine, 1 on the histo slide. So 5 table vivas. So I will help you in preparing the table viva also. So I am an examiner. I go to the students, what question I ask to the student and what I am expecting the answer from them. So to give the viva is an art. You can divert the examiner towards what you want. So it is an art, you know. So smartly you can do it without increasing a doubt in uske dimag mein nahi aane se bhi you can do that. So these are the 5 exercises in which I will help you for how to do it also practically and how to give viva about them. Now there is a grand viva. There is a grand viva, 50 marks grand viva. You know, in grand viva everything. The viva can go anywhere from the entire pathology. You have specimens, you have slides, you have instruments, you have spotters, you have cards. So there is a big table in front of you and many examiners round the table, they are sitting in front of you and one by one, you know, they are bouncing the questions on you. What is this? What is that? What is this? So from here, one question from here. So you have to do, so many students get anxious. So how they know everything, but they cannot speak in front of them. So I will help you to give the grand viva also. What frequently questions? What are the favorite topic of the examiners for the viva? I will help you with that. Specimens, you know, museum specimens, I will help you. I will help you with all possible instruments in the pathology and the cards, you know, last but not least. So I will teach you the entire pathology with the help of flowcharts, images, line diagrams, and mnemonics. No paragraph reading. All the conceptual information I will give you in the form of flowcharts, images, and line diagrams. My teaching way is very different. And mnemonics I will give you for factual information. The thing you have to learn with mnemonics so that you will have a you can remember it for a longer period. So from 2019 batch onwards, you have only 1 month, 1 hours. You have only 12 months for your exam. So whatever batch you belong to, if you are watching this video, whether live or recorded, I request you, please in the comment box, please share with your exam date. Whatever, at least month of your exam. What is the month of your exam? If you know the exact date, if it's well, please write down in the comment box. So I will help you with a timetable. I will help you with a timetable for you for your exam. How to, you should make a timetable and stick to that timetable. I will give you tips for that. So don't forget to drop a comment here in the comment box. Thank you very much. And I'm always here for you people to simplify this beautiful subject for you. So don't hesitate to ask your any doubts related to pathology here to me. I will definitely respond you, and my best wishes are always there for your success, the grand success of your future. Thank you very much. Thank you very much. And if you like the lecture, don't forget to click on the like button. Please drop a comment, share with all your friends, and don't forget to subscribe our channel, that is Future Doctors. Thank you very much. All the best. See you. Bye bye.